So I think it's helpful to think about recovery in phases. I mean, phase one is the surgery itself taking place. That's my job. Phase two is the wound healing, soft tissues, and phase three is the bone healing. Unfortunately, phase two and three fall to the patient, and therefore we need compliance. And it's a big undertaking, and that comes into the decision making, because although there are lots of advantages with the minimally invasive surgery, and it's a true evolution of technique, it doesn't turn it into a haircut, and nothing in modern life can happen fast enough. But I'm afraid that bunion surgery, the recovery isn't fast. So return to function's pretty quick, and pain levels are very low. And actually that can be a bit of a concern sometimes, because it makes you feel like you could do more, and what does the doctor know? I've got a busy life, I need to crack on. And that's where I need to ask for your help, because you really do need to look after the foot. And it does make a big difference in terms of outcomes and avoiding complications, which is what all of this is about. So in that initial post-operative period, the first 2 weeks, it's all about wound healing. And because of the injury, the controlled injury we've created to correct the bunion, we need you to keep the foot or feet, if you've had both feet operated on, elevated very strictly for those first 2 weeks. And we talk about 50 minutes of elevation out of each and every hour. Now that doesn't mean you're glued to the chair for 50 minutes and then get up and have a run around. Quite the opposite. You can get up whenever you need to, but only for short periods of time, and you're walking very slowly. So you can get to the bathroom, you can make a cup of tea, something to eat, those sort of things, but you wouldn't go for a walk. Most people stay inside for those first 2 weeks. So you might get up to the bathroom 5 minutes, you might then 10 minutes later get up and make a cup of tea, and that's really your 10 minutes in that hour. Whilst you're sitting with your feet up for long periods, as you will be, we get you to bend the feet and ankles up and down 10 times every 10 minutes whilst you can remember, and that keeps the muscles working and that keeps the blood flow moving. Getting up at least once an hour, even just to stand, is also good for your circulation and important. So those first 2 weeks are all about wound healing, and by keeping the feet elevated, you will minimize the swelling. Gravity will be drawing the fluid, the swelling, away from the feet. That improves the blood flow, improves oxygenation, and that improves healing and reduces the risk of infection. Super important. I'll then see you at the 2 week mark. We have the grand unveiling. The little incisions, they're very small, are stitched with absorbable sutures, so they don't need to come out, they just fall off of their own accord, and there's usually very little to see for the surgery, which is great. After those first 2 weeks, then what happens after that? Well, we're into phase three. Phase one, surgery. Phase two, wound healing. Now phase three, bone healing. Now the bones actually take months to heal properly, but we know that after about 4 to 6 weeks, there's enough strength that you can begin to do a little bit more. Now, patients always ask me, well, how long does it take for the bones to be strong enough for me to do this or that? And the truth is we don't really know, because it's a complex equation and it's very individual. So it depends on your bone density, your bone strength, your healing capacity, the speed of that healing, and then of course other factors, your mechanics, the activities you like to do, the footwear you use. So it's a really complicated equation. So we do operate on a sort of one size fits all, and that has served me very well in terms of outcomes. And deviating far from that just increases risk, and my job as a surgeon is to try and minimize risk and try and ensure that you get the outcome you want. So I say it's all an investment, but I accept that I get the easier bit, and 6 weeks is a long time to be curtailed in terms of your activity. So we set very strict elevation for the first 2 weeks. Then I see you, we check the wounds, the grand unveiling, you can see the foot or feet that have been operated on. And then you remain in the stiff-soled protective shoe. That's like a black slipper. We give it to you in the ward before you go home. Physios will have made sure that you're safe walking and managing stairs. We give you crutches, although they're really for support. During the first 2 weeks, most people stay in the post-operative shoe all the time, and they often wear it in bed at night because you're not really going out, and it just avoids the need to put it on in the middle of the night. you've got this shoe for 6 weeks and you must wear it whenever the foot is to the floor. So in those first 2 weeks, when you're just getting up to the bathroom, make a cup of tea, it's nice not to have to think about putting the shoe on. And that's why I suggest most patients keep it on all of the time. After the first 2 weeks, most people don't still want to wear the shoe in bed, and they are it's a bit more ingrained, the process, and easier to remember to put that shoe on, but it's vital. The only time after the first 2 weeks that you don't need to wear the shoe is in the shower. So after the first 2 weeks, you can take a shower, you can get the foot wet, not before. And when you're in the shower after those first 2 weeks, you do not need to wear the shoe, but you dry your foot and you put the shoe straight back on. So for the first 6 weeks, the take-home message is you're in the shoe, the post-operative shoe, whenever the foot is to the floor. And as I say, the only exception after the first 2 weeks is when you're in the shower. The analogy I use during those first 6 weeks is walking like an elderly penguin. So it's short, slow steps, and everything at a very slow pace. And with that, what you avoid is loading the forefoot. You don't have to walk around trying to walk on the heel. If you take short steps, the load will remain only in the heel, and that's super important. So you've got, as I said, these phases of surgery, and the first is the actual surgery. The second phase is the wound healing, and now we're talking about the third phase, the bone healing. And whilst the bones take several months to heal, it's those first 6 weeks that are the most important, where there's a little bit of bonding taking place that shares the load with the screws that we've used to hold the bone still. And by 6 weeks, that's when we can contemplate safely getting you back into your own shoes.